Welcome everyone. Today we shall see about classification of drugs. Talking about classification, it's really very broad. And here we are categorizing into four. So first one is biological classification, second one chemical classification, third one classification related to commercial consideration, and the last one based on lay public. So let us see one by one. So first one is biological classification, that is a disease oriented classification, that is drugs that helps to treat any disease or any physiological disorders. Okay, it may be any infection or it may be other physiological disorders such as disorders in blood or blood circulation or disorders in gastrointestinal tract, etc. So any drug that helps to treat diseases or any other physiological disorders can be referred or categorized under biological classification. So again here four categories. So first one, drug acting on central nervous system and peripheral nervous system. And the second one, chemotherapeutic drugs. Third one, pharmacodynamic agents. And last one, metabolic diseases and endocrine function. So before entering, let us recall our basics. Okay, so here respiratory system, that is our lungs, that is helping to inhale as well as exhale this oxygen and carbon dioxide. Okay, it helps to take up oxygen and helps to remove the waste product, that is carbon dioxide, that are produced during metabolism in our body. And the circulatory system or blood, that is taking this oxygen from the lungs and is circulating to all the parts as well as muscles, and from the muscles it is removing this waste product carbon dioxide to the lungs, and from lungs it is being expelled. Okay, that is circulatory system. So this blood helps to circulate oxygen as well as nutrients to all the parts as well as muscles. So next one, digestive system. So here food is taken through our mouth and it is entering our stomach, and there it is digested through our digestive enzymes as well as the pancreatic secretions, that is seen below the stomach. Okay, and from there nutrients will be absorbed and fats will be absorbed for future use. Okay, and that is related to digestive system. And the last one, the nervous system. Again it is divided into two: central nervous system, peripheral nervous system. So central nervous system consists of brain as well as spinal cord. And looking into the brain here, and again there are three parts. First one is cerebrum, next cerebellum, and the third one medulla oblongata. So this medulla oblongata is related to involuntary activities, and the cerebellum is involved in muscular movements and motor functions, and the cerebrum is involved in cognitive functions, that is learning, reasoning, perceiving things, thinking, ideas, then recalling, remembering, and then functions related to our sense organs, smell, taste, hearing. Everything will be because of this cerebrum function. Okay, so here the spinal cord, this acts as the mid between this brain as well as this peripheral nervous system and muscles. Okay, so the next one is peripheral nervous system, and again it is divided into two: autonomic nervous system and somatic nervous system. The somatic nervous system that deals with voluntary activities, voluntary movements, that is because of the sensory organs. That is, we are stretching our hands and we are blinking our eyes, and lips are moving while talking, and these are voluntary movements. Okay, we know when we need to open our eyes, we are opening. Okay, that is voluntary. Okay, we are thinking and we are doing. Okay, that are voluntary movements. We need to wave our hands and we'll be waving. Okay, that depends on us. Okay, and that is voluntary movements. Okay, we ourselves decides these movements. Okay, whether to blink our eyes, whether to stretch our hands, etc. Okay, if we are touching any hot body, we'll be suddenly stretching out our hand. Okay, these are voluntary movements by reflex action. Okay, and the next one is autonomic nervous system, and that is dealt with involuntary movements that is taken inside our body, that's not under our control, and it will be automatically moving. Okay, those muscles, hot muscles, they are automatically pumping. Okay, and this gastric muscles, they are automatically moving, and these bowel movements, etc., all will be coming under involuntary movements, and that will be coming under this autonomic nervous system. Okay, similarly, this pupil contraction, that is when we are facing excess light, this pupil will be constricted. Okay, okay, so, and similarly, when we are facing darkness, this pupil will be automatically dilated, so that more amount of light will be entering to our eyes, so that we can see things more clearly. Okay, and these all coming under involuntary movements that are under the control of autonomic nervous system. Again, this autonomic nervous system is divided into two. First one is sympathetic nervous system, and the second one is parasympathetic nervous system. So first one, sympathetic nervous system, that deals with actions. Okay, that is coming under when there is emergency or stress situation, the sympathetic nervous system will be stimulated, and it will be helping us um, to lead out of this emergency situation, that is due to flight or fight mechanism. That is when we are facing any snake, we either have to flight out from that spot, that is run out from that spot. Okay, or we have to fight against that snake. Okay, we have to kill the snake. Okay, otherwise we will be killed. Okay, that is flight or fight mechanism. Okay, that is due to the induction or stimulation of sympathetic nervous system. That is, our blood pressure will be raised and our activity will be increased. Okay, and then parasympathetic nervous system, that is relaxing stage. Okay, that is due to these parasympathetic nervous system, that cools down our system, so that will be maintained in peace. Okay, that is resting. Okay, and so now we can enter into our topic. That is, first one is drugs acting on central nervous system and peripheral nervous system. So central nervous system, we know, that is brain and spinal cord, and peripheral nervous system, that is the nerve branches that are coming from the spines. Okay, spinal cord, and that helps in communication between muscles as well as our central nervous system. Okay, and now again under this, four categories. First one is non-selective CNS depressants, and second one is CNS stimulants, third one selective CNS modifiers, and the last one drugs acting on peripheral nervous system. So first one, before entering into this, just we shall know about this neurotransmitters. Okay, what do you mean by neurotransmitters? It is communicators between these neurons as well as muscles and other parts. Okay, this muscle have to communicate to the brain, and also the brain have to communicate with the muscles. So this is done via this neurotransmitters. Okay, this peripheral nervous system will release some of the neurotransmitters that helps in communicating with the brain, for example acetylcholine. And similarly, this brain will be secreting a lot of neurotransmitters, more than 10. Okay, for example the serotonin. Okay, and this will communicating with the muscles via this neurotransmitters. Okay, so the communication, to establish communication between this brain as well as the other parts as well as the muscles, this neurotransmitters are functioning. Okay, for example, if you are touching a hot body, this hand will communicate to the brain, or it will send signals, impulse via this neurotransmitter, such I'm feeling somewhat hot here. It will be telling. Okay, then this brain will instruct the hand to just remove out. Okay, okay, if you are feeling hot, just remove your hand from that. It will be sending its signal for the hands, that is towards the peripheral nervous system. Okay, and so it will just remove out its hand. It will be in fractions of seconds, this communication. Okay, so that is about neurotransmitters. And now we can enter into a topic, drugs acting on central nervous system and peripheral nervous system. Okay, so we know that central nervous system means brain and spinal cord, and the peripheral nervous system, that is branching from this spinal cord. Okay, so first one is non-selective CNS depressants. So from the word depressant, we can understand that it will depress the brain function. That is, it is depressing the central nervous system as a whole. Non-selectively, as a whole, it will depress the central nervous system. It will decrease the function of central nervous system as a whole. Okay, that is non-selective CNS depressant. It will not be acting on any particular area, but it will be depressing as a whole. Okay, it will depress central nervous system as a whole, and such drugs that decrease the function of central nervous system non-selectively can be called as non-selective CNS depressants. Okay, for example, general anesthetics. Okay, so here if we are met with the accidents or some major surgery has to be performed, then the doctors will give us general anesthetic so that our whole body will be resting and will be unconscious and we don't feel the pain at all. Okay, that is general anesthetics. It will control the entire body, that is, it will control the central nervous system as a whole, and so the whole body will not feel any conscious or pain. Okay, so next one, hypnotics, sedatives. These are all psychiatric drugs. That is based on the patient's severity. We will be giving such medicines. That is, for example, barbiturates for those patients if they are reporting that they can't be able to sleep. Okay, so they'll be giving at a milder dose so that they'll be having a peaceful sleep. Okay, and if the patient is reacting very rigorously, aggressively, then what happens? We have to increase the dose. Okay, so that their anxiety, stress, tension can be reduced, their aggressiveness will be reduced. Okay, they'll be sleeping peacefully too. And after increasing this dose further, it will be causing unconsciousness, and further if we are increasing, it will cause death. That is, the whole system will be sleeping. Okay, so death. So that is the lethality regarding this drugs. Okay, so the mode of action is, it will be enhancing this gamma aminobutyric acid. Okay, so this is a neurotransmitter that is secreted in our central nervous system, and it is having an inhibitory action. Okay, so as in general, this neurotransmitters, some of them will have inhibitory activity and some of them will have excitatory activity. That is, some of them will reduce blood pressure and some of them will enhance the blood pressure. Okay, this gamma aminobutyric acid will decrease the blood pressure. It will give calming effect. Okay, so all these depressants, that is mainly this barbiturates, will enhance this gamma aminobutyric acid so that our brain will be resting. Okay, and that is regarding CNS depressants. And the next one is CNS stimulants. From the word itself, we can understand that these drugs stimulate the central nervous system, or it will increase the function of central nervous system. We will be giving some excitatory response. Okay, so here again we have two categories. First one is sympathomimetics and second one is general stimulants. Okay, in first one, sympathomimetics, again it is divided into two: psychomotor stimulants, and second one is psychotomimetics. Okay, first one is psychomotor stimulants, that is, our motor activity will be stimulated. Okay, for example, if a particular person is involved in some heavy physical activity, that is, they can carry lots of sacks all throughout day and night. Okay, such heavy burdens they will be loading in their shoulder, and so their muscles will be aching and their whole body will be aching. So for the next day they will be unable to do any such physical work. So to control this, so that they can have a sound sleep, they'll be taking such psychomotor stimulants. For example, xanthines, nicotine, etc. These drugs will relieve them out of pain. Okay, they won't sense any pain. Okay, they'll be feeling somewhat excited and they'll be active. Okay, so that increase their motor activity so that they can work, okay, continuously. That is regarding psychomotor stimulants. And the second one is psychotomimetics, that is mimicking the psychiatric drugs. Okay, as a whole, the sympathomimetics mimics sympathetic nervous system function. Okay, so sympathomimetics mimics sympathetic nervous system function, that is, it will increase the blood pressure. Okay, so here again psychotomimetics mimics psychiatric drugs that will act on the thought and its perceiving mode. For example, lysergic acid. Okay, so what this will do is, it will reduce the communication between this neuron as well as the muscles, this peripheral nervous system. Okay, so because of this reduced communication, we can't perceive things normally. For example, if a particular rope is lying near to us, we won't be feeling it as rope. We may think it as a snake. Okay, so there is a gap in communication between the neurons. Okay, so such reduction in communication, that is by the psychotomimetics. Okay, overall it will be acting as a stimulant. For example, this could be a good drug for addictives. Okay, drug addictives, smokers, and to just get rid of from this addiction, the psychotomimetic drugs can be advised so that they'll be feeling stimulated, but their perception and thoughts will be somewhat changed. And say, though these candidates will not depend or rely on this particular drug more. Okay, slowly they'll be withdrawing from this addiction. So again, here also, when we are taking in higher dose, it will result in death. Okay, at lower dose, you'll be feeling somewhat excited. You won't be sleeping, and you'll be working continuously, such that somewhat excited. Okay, and after that, after a particular dose, you'll be feeling vomiting and convulsion, etc. And after that, our heart rhythm will be affected. Okay, normal laptop will be erased out, and it will be just pumping out abnormally, and finally it will be lethal. Okay, that is about CNS stimulants. So overall, the CNS stimulants enhance or increase the function of our brain. Okay, so mostly they will be non-selective in nature, that is, they will be affecting the central nervous system as a whole. They may act on a particular receptor, but they will control the CNS as a whole. Okay, here two types: sympathomimetics, that is mimicking the sympathetic nervous system. Next one is general stimulants. This sympathomimetics, again psychomotor stimulants, that is enhancing our motor activity against pain. And second one is psychotomimetics, that is mimicking this psychological drugs. Okay, psychiatric drugs, that is change in perception and thought. Okay, so that it can be help to retrieve some drug addictors. Okay, that's about CNS stimulants. And the next one is selective modifiers of CNS. So from the name itself, it will selectively modify. Either it can depress or stimulate selectively only a particular area of the CNS and not as a whole. Okay. So for example, antitussives, that is cough center. It will suppress only the particular area in the brain so that our cough will be controlled. Okay, by suppressing the particular cough center in our brain, our coughing will be suppressed. We'll be relieved of from our cough. Okay, that is the mode of action of antitussives. And the next one is anticonvulsants. That is, this convulsion is mainly due to overactivity, that is over nerve impulse, that is over communication between neurons. Okay, and because of this over communication, over electric signals within the neurons, this brain will be confused, and because of this epilepsy is caused, that is convulsion. Okay, and so this anticonvulsants will reduce this neuron activity so that it will remain in peace. Okay, that is about the selective modifiers. So it will selectively modify a particular area in our central nervous system, and so that its action can be imparted. Okay, that is selective modifiers of CNS. It will not act as a whole. Okay, it will control only a particular area. And the last one is drugs acting on peripheral nervous system. So talking about this peripheral nervous system, we have already seen that is two types: autonomic nervous system, somatic nervous system. And the somatic nervous system controls voluntary movements, that is our sensory activities. Okay, waving our hands, moving our legs, walking, talking, etc. And this autonomic nervous system deals with involuntary activities, that is within our body. Whatever movements happening within our body, that will be in the autonomous nervous system control. And again, this autonomous nervous system is divided into sympathetic nervous system and parasympathetic nervous system. And the sympathetic nervous system is dealing with action, that is during time of emergency it will be activated. Okay, so this epinephrine, that is adrenaline will be released, and our blood pressure will be enhanced, and we will be acting smart. Okay, for example, if you are facing any wild animal, either we have to kill the animal, or either we have to fled out from that particular spot, otherwise we will be killed. Okay, so in such emergency situation, this epinephrine will be stimulated, this parasympathetic nervous system will be stimulated, and it will instruct us either to run or to beat and kill the animal. Okay, so that is fight or flight response, that is due to sympathetic nervous system, due to the release of epinephrine or norepinephrine. Okay, and the next one is parasympathetic nervous system, that is for our calming effect. We'll be feeling calm and stress free due to the release or stimulation of this parasympathetic nervous system, mainly due to the release of acetylcholine. Okay, so acetylcholine is the important person here. Okay, due to the stimulation of this acetylcholine, what happens, this is also again a neurotransmitter. Okay, and this epinephrine also is a neurotransmitter. Okay, so because of this we will be feeling peaceful, and there will be in the resting state, that our blood pressure will be reduced here. Opposite effect, sympathetic as well as parasympathetic, both are opposite to each other. Okay, so now we can see here four categories, subcategories here. First one is local anesthetics, that is we have already seen, that is general anesthetic, that will be controlling the entire CNS, and our entire body will be unconscious, and we won't feel pain anywhere. Okay, here in the local anesthetics, this particular drug will control the particular area of the peripheral nervous system, and it won't control the central nervous system. Okay, so it is acting on a particular peripheral nervous system, so that the particular area will be numbed and there won't be any pain. For example, if you are having any wound in our hands, and or if you are having toothache, okay, you won't be able to feel or sleep. So by giving a local anesthetic into our gums, what happens, we won't be feeling any pain in the teeth moreover, and after that we can have a good sleep. Okay, so we won't feel pain only in the mouth area. Okay, otherwise we can feel any pain. If we are pinching in our hands, we can feel pain. Okay, only it is acting on that particular area, that is local anesthetic. Okay, it will be acting on the peripheral nervous system and not the central nervous system. If it is acting on the central nervous system, as a whole the body will be numbed and we can't feel any pain anywhere. Okay, here it is acting only on the peripheral nervous system, that is a branch from the spinal cord, that particular area. If we are administering this particular anesthetic in hand, this particular hand will alone be numbed. Okay, and we won't feel any pain in the hand. For other parts, we will be having a pain and conscious. Okay, so that is about local anesthetics. And the next one is cholinergic and anticholinergic drugs, that is due to the release of neurotransmitter acetylcholine. To speak about acetylcholine, it is responsible for the activation of muscles as well as the cognitive functions. Okay, so such as learning, thinking, reasoning, problem solving, decision maker, everything is dealt with this acetylcholine. Okay, when it is gets stimulated, we'll have a sound cognitive response and our muscles will be activated good. Okay, so if this acetylcholine is blocked, what happens, our muscles will be paralyzed and there won't be any movements for our muscles. So that is about acetylcholine. That is Alzheimer's disease, that is also due to the lack of this acetylcholine, and because of this muscles will be somewhat weakened. Okay, and we won't be able to think normally. Okay, that is due to the lack or deficiency of acetylcholine. Okay, so to enhance this acetylcholine, cholinergic drugs can be advised. Okay, if your muscles paralyzed, for example, during this snake bite, automatically this acetylcholine esterase will be broken off. Okay, and so acetylcholine will be reduced there. Okay, so here what happens, this acetylcholine is blocked during a snake bite, and so muscles will be paralyzed, and in such conditions cholinergic drugs are advised. Okay, that is anticholine esterase. Choline esterase breaks down this acetylcholine, and so we have to give anticholine esterase so that acetylcholine will be synthesized and our muscles will be actively participating. Okay, that is the function of cholinergic drugs. And the next one, anticholinergic drugs, that is if due to excess stimulation of acetylcholine this muscular activities or movements will be very high. For example, this gastrointestinal or bladder movements are very high, will be frequently uh, giving out urine or diarrhea. Okay, because of excessive movements, and so just to reduce this acetylcholine, okay, this anticholinergic drugs can be advised. Okay, so that is regarding this acetylcholine that is responsible for activation of muscles. If there is too much of activation in muscles, there can be excessive involuntary activities, so that our stomach, for example, stomach muscles will be pumping, and the food items there within the stomach will be going out frequently, and if the bowels are frequently pumping, urine will be going out frequently. Okay, so excessive movement is also not advisable. Okay, that is also dangerous. And also if there is no movement, our muscles will be paralyzed, we can't move our hands, legs, etc. So normal secretions has to be there. So if it is below normal, we have to give cholinergic drugs, and if it is above normal, we have to give anticholinergic drugs. Okay, so the next one is adrenergic drugs, that is dealt with this epinephrine. Okay, that is adrenaline, that is the neurotransmitter released during the time of emergency or stress danger. Okay, this epinephrine will enhance our blood pressure. Okay, and similarly this adrenergic drugs can be given for those who are having decreased blood pressure. Okay, if they are having low blood pressure, they can be given this adrenergic drug so that this blood pressure can be increased to a normal level. Okay, and similarly this adrenergic blockers, okay, anti-adrenergic drugs can also be given for those persons having excess stimulated epinephrine. Okay, they will be having high blood pressure due to stimulation of this epinephrine. Okay, so to reduce this blood pressure, we have to give adrenergic blockers. That is about adrenergic drugs. Okay, and the next one is histamine and antihistamine agents. Histamines, we already know that this is secreted by basophils of our white blood cells in response to some other foreign infections. Okay, so if this secretion, histamine secretion, is high, that is hypersensitivity towards foreign substances, mainly foreign proteins. Okay, because of this hypersensitivity reaction, the histamine secretion will be very high, and because of this some allergic symptoms will be experiencing: puffiness in face, reddening in eyes, tears will be coming out, then coughing, sneezing, etc., etc. Okay, in such allergic symptoms can be controlled by giving antihistamines. Okay, this antihistamines will decrease or reduce the histamine secretion. Okay, that's the function of antihistamines. Histamines are secreted by our basophils in reaction to some other foreign infections. Okay, so it is a normal required function, but if this reaction is hyper, okay, if a hypersensitivity is experienced, abnormal excess release of histamine will be experienced, and because of this, unwanted symptoms, allergic symptoms will be facing. And to control this allergic symptoms, we can have this antihistamines that will control this histamine release. Okay, and the other one, histamine drugs. Histamine drugs have the purpose, that is, it will have some long term memory effects. Okay, nowadays they have explored out that this histamine release in our brain will enhance its long term memory. Okay, so for certain or very rare patients, they'll be giving this histamines. Okay, histamine stimulants or histamines, that is to enhance their long term memory effects, etc. Okay, so that is about the drugs acting on peripheral nervous system. Okay, so let us recall. So first one, classification, 4 classification: biological, chemical, and then classification based on commercial consideration, and classification by lay public. And here in this section we will be dealing about biological classification, and in this biological classification again we are having 4, and again among these 4 categories we are dealing only with this drugs acting on central nervous system and peripheral nervous system. Okay, so this biological classification is disease oriented classification, that is the drugs acting on infections or any physiological disorders. Okay, so here it is categorized into drugs acting on central nervous system and peripheral nervous system, and second one, chemotherapeutic drugs, pharmacodynamic agents, and last one, metabolic diseases and endocrine functions. So here you can recall this, okay, the facts about some systems in our body. And the next one, the drugs acting on central nervous system and peripheral nervous system. Here again 4 subcategories are there: non-selective CNS depressants, CNS stimulants, selective CNS modifiers, then drugs acting on peripheral nervous system. Okay, here neurotransmitters, we know that it is the communication between neurons. Okay, and the peripheral nervous system is due to this neurotransmitter secretion or release. Okay, and drugs, next one is drug acting on central nervous system and peripheral nervous system. So of course we know about central nervous system, that is constituting the brain and spinal cord, and then this peripheral nervous system, that is the nerve branching from the peripheral nervous, spinal cord. Okay, and here first one is non-selective CNS depressant, that is decreasing the function of central nervous system as a whole. This non-selectively it will decrease the function of the central nervous system as a whole. That is about non-selective CNS depressants. Example, general anesthetics, hypnotic sedatives, etc. Okay, here also you have to limit our dose, or otherwise it will be lethal. And next one is CNS stimulants. It is also non-selective. Mostly they are non-selective in nature. Okay, as a whole, the CNS as a whole will be stimulated. That is, as a whole, the function of the central nervous system will be increased. Okay, so here again 2 categories: sympathomimetics, and next one is general stimulants. And sympathomimetics mimics sympathetic nervous system, that is blood pressure will be enhanced and it will be involved in action. Okay, And again, it is having subcategories, that is psychomotor stimulants, that is motor activity will be stimulated, that is sense of pain will be reduced, and they will be feeling excited, and they can do work more. Okay, they can actively work any physical work more. And the next one is psychotomimetics, that is it mimics psychiatric drugs, that is it will affect our thinking, perception, that is perceiving things. Okay, that is due to reduction in communication between our brain as well as our muscles. Okay, and because of this reduced communication, our brain cannot communicate properly, and so we will be perceiving things differently. Okay, that is psychotomimetics. And again, here also, if the dose exceeds, it will be lethal. Okay, in the next category is selective modifiers of CNS. It will selectively modifies only a particular area of central nervous system and not as a whole. Okay, so for example, this anticonvulsants, antitussives, etc. Okay, and the last one is drug acting on peripheral nervous system. And again, this peripheral nervous system, we are having two: somatic nervous system, autonomic nervous system. Somatic nervous system involved in voluntary movements. Okay, that is our sensory activities, waving our hands and moving our legs, walking, etc. Okay, and this autonomic nervous system, that is participating in involuntary activities, that is taking place within our body without our control. Normally it is happening, heartbeats and the movements in our stomach, bowel movements, bladder movements, etc., etc. They all happening naturally without our control. Okay, they all coming under autonomic nervous system. Okay, so again, this autonomic nervous system, it's divided into sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system is for action. Okay, in times of emergency, in times of need, it will be activated and it will help to protect our body. Okay, that is fight or flight mechanism. Okay, and then the next one is parasympathetic nervous system, that is opposite to the sympathetic nervous system, that is due to the release of acetylcholine. Okay, it will give peace and it will calm down our body. Okay, and that is rest response. Okay, and again, here subcategories are there. First one is local anesthetics, that will be acting only on a particular area, that is due to particular peripheral nervous system action. Okay, and this drugs will be acting on the peripheral nervous system, and so it will be creating numbness only on the particular area and not as a whole. And the next one is cholinergic anticholinergic drug, that is controlling the release of acetylcholine. Acetylcholine is involved in activation of muscles and cognitive functions. So excessive release of acetylcholine will cause diarrhea and excessive urination, etc., and our heart beat will be pumping fast, etc. Okay, so for that, anticholinergic drugs will be advised. And if the secretion is less, then muscle paralysis and our thinking will not be normal. Okay, and in such conditions, cholinergic drugs will be given. And the next one is adrenergic drugs, that is required for emergency situation, that is epinephrine release. Okay, this epinephrine or adrenaline release helps in our flight or fight mechanism. Okay, but if this epinephrine is reduced, okay, our heartbeat will be reduced and we will be having low BP. And in such conditions, to enhance our BP, we will be given this adrenergic drugs. Okay, so if we are having high blood pressure, we will be giving this adrenergic blockers. Okay, and the next one is histamine and antihistamines. Histamines are normal secretions by our basophils to protect from foreign infections. If this secretion is excess, we'll be feeling some allergic symptoms, so we'll be given antihistamine agents. Okay, and again, histamine agents are also advised for long term memory. Okay, that is also there. And so hope you find it useful. Thank you.